y'all, it's Rose, and today I'm going to be doing a video about how to care for your incision after having spinal fusion surgery, aka scoliosis surgery. So this is about how to care for it before and after, how to care for your back before you have surgery on that surgical area where the incision will be, before and after. So this video helps you guys out, and if you have any questions, you can let me know. So basically, a couple weeks before surgery, I only washed my back and where the surgical incision area would be with a sensitive skin body wash, so that way my skin wouldn't be irritated from any fragrance filled soaps or shower gels. I don't recommend using fragrance and perfume body washes before surgery on the area that you will have your incision. They do give you a antibacterial cleanser to clean where the surgical area will be of your incision. But anyway, just leading up to it, just try to keep away from getting breakouts and stuff. I would just use a sensitive skin body wash or a normal one without fragrance. But that's what I done. I always use that anyway because I have sensitive skin on my face and stuff. I don't use a lot of heavy products on my skin, but yeah, so that's what I use. And then the night before surgery, I used this Hybiclens, I think is how you say it. And I actually have the paper that they gave me. My anesthesiologist had the Hybiclens soap to wash before surgery. So it was the night before and the morning of. So I did 2 washes with that. And you just do it in the shower, and you just do it where you will have your incision. But your anesthesiologist, well, that's who explained it to me, I guess. But the people there at that doctor's office, or that will be explained to you, but if you're getting surgery. So this is what it looks like. The one that I got is the Hybiclens, and this is the paper that they gave me. Anyway, so it was a red soap, and it kind of just smelled like a cleanser. A really strong smell, I guess, that you would just clean the surgical wound area. That's what it says. I actually circled that right there. So yeah, I just put that on, left it on. I think it actually tells on this paper, you rinse it after you put it on there, just leave it on there for a minute or 2. So that's what I done. I think I let it set for just however long it says, I can't remember. And then I washed it off. And then the morning of surgery, which was at 4 o'clock in the morning because I had to be there so early. Anyway, I did it again, and then yeah, that was basically it. But then after I got the surgery, I had this big giant band-aid. Sorry, this is my ponytail holder thing. I keep playing with it, but I had this big bandage that went down my back, so that stayed on there for until I went back to the doctor the next week after surgery, and then my surgeon took it off. And then there was a tiny clear along the incision, an antibacterial tape strip, so that way it wouldn't get it wouldn't be open, because it's not all grown back together, and your skin is still creating new skin to heal up. But after surgery, that strip was on, but you could still see the incision as the tape would come off. And I'm actually just a month over post-op, so all the tape has come off. So it's basically just the incision, and I still use the sensitive skin wash because that's what works best for me. And I haven't had any breakouts or any I guess what you call acne on your back or something from it, because I know sometimes people have that. So definitely, if you do, I would definitely recommend getting that body soap, that body wash. It's just like a regular body wash with no fragrance. Because that is sometimes can irritate and dry your skin out, the fragrance perfume stuff. So yeah, that's basically all that I do. I do loofah sponge, and I have a exfoliator. It's this big, so you can use it on your back too. And after surgery, you can use a washcloth just around your incision on your back where they did the surgery, just very slightly. I actually had to get some help with doing that because you can't turn around yet. And then you just wash around that really good until all the tape comes off. And then sometimes there will be barely a strip of tape left, which I did not peel or try to force any of that to come off on its own. I just let it go by itself. Even if there was that much tape on it, I wasn't gonna put Vaseline, which I'm sure wouldn't hurt, of course, but I just let it come off on its own. And then when I take a bath or something, that can kind of help because it soaks the tape and kind of gets it a little bit more wet, so it will just kind of fall off on its own. But yeah, that's basically all that I've done. And yeah, that's pretty much it. If you have any other questions, you can let me know in the comments. Now, everybody's journey, everybody's experience is different with surgery, especially like if you have like different type of tape or different type of bandage, it can be different with how you know, how it heals up, or not really how it heals up, but how the process of that comes off. So yeah, but that's basically all. And yeah, so you can let me know if this helps you out, and I hope so. But just remember, like, it's not always the same for everyone. Some people might actually not use this. They might use a different one. Just depends on the surgeon and what they recommend for you. So yeah.